The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm your host, Shay Paul, and today I have Dr. Jarrett Chapman of Living Well joining us. Dr. Chapman, thank you so much for being with us.
Thank you for having me today.
So today we're going to talk about a subject that's kind of near and dear to my heart right now, and that is aging. And we're seeing so much hype, like on TikTok, and I know I'm constantly being flooded with social media ads about the trend of estrogen, using like estrogen and hormones in our skincare products to help
Yes.
us combat aging. And I'm hoping you can kind of tell us if that's myth or true or.
So actually, it is truth. Loss of estrogen leads to aging, as we well know. So the process kind of goes like this. As women move into their late 40s and early 50s, they start to slow down their production of estrogen and they go through a phase of life called menopause. And, it's something that most women struggle through because there's very little out there education wise and really understanding of what happens to a woman's body during this time, although we're advancing and doing much better at this now. But there are so many women who've had to struggle through this stage of life, being told just deal with it. But one of the things that happens is as you lose estrogen from your body, you start to advance in the signs of aging. The skin will lose its tension and will become lax. There will be crepiness that will develop to the skin because basically you're losing the stimulation that produces collagen and elastin in the tissue. That estrogen does so much for your body, and as it starts to fade away, the signs of aging advance quickly. What you notice is a woman through her 40s, as she begins to move into her 40s, she's looking great. The man, on the other hand, as he's coming through his 40s, as he's losing testosterone, he is starting to age more rapidly. So men in their 40s to 50s start looking older faster. But when we get to about 50, 52, guess what happens? The aging process in a woman accelerates. And by 55, she is far exceeding the rate of aging over her male counterpart. And so that has to do with that loss of hormones and that imbalance that occurs. So, yes, there is some truth to putting estrogen in skincare. It definitely does stimulate the collagen in the tissue. There's a study recently out that's showing that estrogen applied to the skin does increase the collagen content of the skin. However, you need to be very careful with this. You need to,
I would
make
think.
sure that your risk factors are, you've vetted your risk factors with your provider and that you're not just getting something over the internet or over the counter that has really not been studied and is not approved for use topically like that. And I definitely wouldn't just go to the cabinet and grab the estrogen cream and start rubbing it in your face if a provider has not told you to do so and
I
how to
was
use
wondering
it.
if women
So
might be doing that right now.
I I know they are. I know for a
Yeah,
fact
that's
they
that's
are.
not
So
smart because,
yeah, so
even if you're applying it topically, I mean that it's absorbing into your
it's
bloodstream,
it is
right?
absorbing to some
Okay.
degree to your bloodstream and is, again, not as significantly as it would if you were taking
Right.
significant replacement. We're not talking about tons of cream here, but even a small amount, you need to vet that through your provider before you do that. I would never recommend to the general public go out and find some estrogen cream and start putting it on your face.
Right.
But there is research coming and there are studies that are ongoing and we are seeing promising results from these studies. So we do know that topical estrogen may play a role in skincare and become more prevalent shortly. And so we like to talk about the things on here that are new and upcoming, and that is one of them. And I think we will see more of that as we begin to progress. And also, just hormone imbalance and hormone balancing in general is a great way to stay healthy. And it's something you should discuss with your provider, your doctor or nurse practitioner or PA that you're seeing and evaluate, your symptoms and evaluate your risk factors and evaluate a possible treatment plan that may help you balance your hormones better. Simple diet and exercise.
Yeah.
I made
Yeah.
a post on Instagram yesterday about living well, and it's just about the things that we do every day that will keep us healthy. And exercise and diet are so important in maintaining good health. And when we neglect those, our aging advances and our health becomes poor. And patients need to understand there is no pill, there is no hormone, there is nothing I can give you that's going to replace you doing what you're supposed to do, which is diet and exercise.
Yeah.
So all that fast food has got to go. All of
Processed,
those
yeah.
all those processed foods have got to go. I'm not saying you can never eat them, but we eat them, we consume them on a daily basis
Yeah.
in multiple quantities. And we've
Yeah.
got to get back to a clean diet, and we've
Mhm.
got to make time for that exercise.
More
People say, I
fresh
don't have
fruits and
time.
vegetables and,
Yes. And people always say, I don't have time to exercise. You got to
oh,
make time. And
yeah.
then it will be so important to you, you'll never, ever give it up for
Oh,
anything
yeah.
else.
And not just your physical health. I know for me, my mental health, if I don't get my exercise in daily, it really, it really affects that too. So,
Absolutely.
all
Absolutely.
right. Well, as always, great information and advice, Dr. Chapman. Thank you so
Yeah.
much for being with us.
And just tell the audience out there if they want to follow us on Instagram, Living Well Aesthetics is our hashtag. So they can go out there and look at us and see this information replayed again, and also follow us for all of the things that we talk about daily.
All right. Great. Thank you so much, Dr. Chapman.
Thank you for having me.